Hi, a very good morning to all of you. Today we are going to discuss the case of Joshua Gibbon, who is suffering from left metacarpal fracture. So let's see the case writing tasks. So the writing task here is write a letter to the nurse practitioner, Miss Sally Morris. So where is she? She is in the fracture clinic, Bayview 53 Street for ongoing care. So we are writing the letter to nurse practitioner who is licensed to care patient, same like a doctor. So she is in the fracture clinic, Bayview 53 Street for ongoing care. So ongoing care is something which we need to underline. Now we have maybe we have another purposes there. So first of all, we are going to see the primary thing is ongoing care. So let's see in detail. The patient name is Joshua Gibbon. You are a registered nurse working in the hospital where he got the treatment from. So Mr. Joshua Gibbon is a 27 years old patient. So how can we identify this is a male client? Because we can say girlfriend and mother. So we said Mr. Joshua Gibbon. We have indicator that this is a male client. Now we have the admission date at 12th of September 2020. Now he came to the emergency department with left metacarpal. The fifth metacarpal has got fractured. He has a history of fibula fracture, leg fracture. Now we need to underline something. So we need this thing, 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 we don't need this thing, we don't need this thing, because in detail. So if you want to say, you can say in very brief, but because this happened in 2006 and the current year is 2000, so almost 15 years passed. Now the patient is 27, so it happened in his 12th or 13th years of age. Years past that there is no clinical significance here. So history of fibula fracture, leg fracture, so there is no clinical significance here. So it may be because of, so, and there is a long history, the treatment is over there. So if I want to say that some sorts of fracture was reported, I can say, but don't specify that this area got fractured. We don't need that. Now paracetamol 1 gram for headache. Okay, so the only medication he is having right now is he's having headache, and we are giving paracetamol 1 gram. So it may be of divided dose, maybe 500 mg in the morning or 500 mg in night. This is the maximum dosage of paracetamol per day it is given. So we have no specification how the dosage is distributed, nothing. So we just have the medication. So we have the medication like that, the current, the only medication he has now is paracetamol, and that's for pain. So his temperature, pulse, and heart rate is normal, but now we have to see another significant thing is that he has pain in the pain scale. 7.5 is the pain scale. And he was seen elevated his hand. Okay, maybe because of pain. I don't know exactly. He needs to elevate or he was elevating. So I assume that elevated hand means he was keeping the hand like this when he came, when we assessed. So it is under the heading assessment. When we assessed, he was just keeping this hand like this, maybe because of it, not like this. So this is what we can assume there. Now, when the doctor assessed the nursing assessment, nothing is there, only the pain is there. Doctor's assessment, he had numbness. And here the patient told that he had a fight with his friend in the evening. So accidentally his left wrist hit the wall and you got the 5th metacarpal fracture. So we are doubting the type of fracture, whether it is a BOXER fracture or not. So that's the thing. Now X-ray confirm, yeah, that it is BOXER fracture. Now what we have said is that the implementation here, the management here, is that we have done close reduction and immobilization with the splint. That's the thing, that we have the data like that. We may have done some other things, but as far as we have, it's not mentioned in the case note, we are not going to mention those things. Now, about the discharge plan, we have given information about the cast care. So cast care, we have splint attached, advice cast care, keep dry, please don't remove the cast, don't insert anything. So these are information which we gave to the, what's the patient's name? His name, Joshua Gibbon. Yeah. So information given to the client. So in general, I can say that the cast care education was given to the client. So we don't need to explain everything. So splint attach, advice cast care, keep dry, don't remove, because we don't need everything. We can just say we have given a proper education regarding the cast care. And when we say, we have to say that we have instructed him to elevate the hand, and we instructed him to report to the emergency department if there is any pain and numbness. So there is a review, physiotherapy review, and the nurse practitioner review is after 1 week with the X-ray. So after 1 week, so the X-ray has to be taken in 1 week. With the X-ray, you have to move to you. I'm writing to you, so you are supposed to assess the X-ray and decide the things, what we have to do here. So we have something here. So what is the purpose? We need ongoing care. We need you to review. So we are going to request Sally Morris for ongoing care and review. So when you review, automatically that is an assessment. So we have the purpose clear here. Let us go ahead with the letter. When we see the letter, 12 September, that is the date when this incident occurred. So Miss Sally Morris. So that is the 1 minute. That is, yeah, that is client's, the nurse practitioner's name. Fracture clinic. So C is to be capitalized there. Bayview 53. Bayview 53 Street. S should be capitalized there. Okay. Dear Miss Morris, yes, dear Miss Morris. Reference Joshua Gibbon, aged 27. Now, up to this point is perfect. Now, this letter is being written to refer Mr. Joshua Gibbon, who has been diagnosed with BOXER'S fracture. So BOXER'S fracture is the diagnosis. So you are going to treat it. You are going to treat Mr. Joshua Gibbon, and he has BOXER'S fracture. The purpose of this letter is to refer Mr. Joshua Gibbon, and he has BOXER'S fracture. Very formal. He requires your expert assistance. He needs your assistance, care, and review as he is returning home today. So after the cast, he is sent home today itself. He is not an inpatient here. So he is returning home. So what he requires is, he requires your expert assistance, care, and review. That's it. So my purpose paragraph is clear there. Mr. Gibbon presented to our care complaining of pain and numbness on his left wrist following an accidental hit against wall while engaging in a fight with his friend today evening. So Mr. Gibbon, what happened to Mr. Gibbon? So Mr. Gibbon presented to our care. He came to our care. So you are working in emergency department. Our emergency department, it is here. Presented to our care, he complained of two things, pain and numbness of his left wrist. You can see that he had pain here, numbness here, two complaints he had. We don't find any other complaint there. Compliance, no compliance. So how it happened? Following an accidental hit against wall while engaging in a fight with his friend today evening. So he was fighting with his friend. So he reported it to the doctor that complaint fracture after hitting against the wall this evening. So this is what we can see there. So he complained of left wrist fracture after hitting against wall this evening. Now, he also kept his hand elevated, and when assessed his pain on the pain scale, it was recorded at 7.5. So we have the observations, the nursing observations here. So the nursing observation is here. So first we have said the doctor's observation. Here it is. The nursing observation is here. So he was seen elevating his hand and his pain scale was recorded at 7.5. So the pain was recorded at the pain scale. Assess the pain on the pain scale. It was recorded at 7.5. Later, an X-ray confirmed fifth metacarpal fracture with displacement. Okay, after that, later, what happened? X-ray confirmed fifth metacarpal fracture with displacement. Okay, so we have written that. Therefore, a closed reduction procedure was done and the area was immobilized with a splint. So what was the intervention there? So a closed reduction, immobilization with a splint. This is what we have seen. So use the connectives appropriately and rationally. We have done that. Okay. He is on paracetamol 1 gram for managing his headache. So that was the only medication we can see in the case note. So we don't skip that. Whether it is given for headache or whether it is given for something, we have to give because it is the only medication. If you have a current medication going on, we have to mention it. It becomes relevant naturally. So the only medication that he is having is a paracetamol here. Mr. Gibbon lives with his mother and his girlfriend. His social history here, he can see that he lives with his mother and girlfriend. He has no significant medical history other than a couple of leg fractures during his adolescence. So nothing is relevant. You can say he has no significant medical history other than a couple of leg fractures, fibula, leg fracture, both are leg fracture during his adolescence. So when he was 12 or 13, it happened. Now he's 27-year-old. So that's what we have mentioned. Just brief it, we don't have to explain it in detail. That's it. So we said that nothing is there, just a couple of fractures. As per the discharge plan, he was educated regarding the cast care and the importance of elevating hand. Cast care, educated regarding the cast care and the importance of elevating hand. He was also instructed to report our emergency department, provided that he feels any pain or numbness on the area. So provided that means if he has any pain and numbness in the area, please report to the ED. He was instructed to do so. And please note, he needs physiotherapy review at the hand clinic. So one thing you need to now is that he needs a physiotherapy review at the hand clinic. So that's the thing here. And the last part here, it would be appreciated if you could review his progress with a repeated x-ray after a week. So specifically what you are going to do is that you are going to review the client in 1 week, what with an x-ray. Okay, so that's what we have said. If you have any further queries, please do not hesitate to contact me. Yours sincerely, because we have written the name of the nurse practitioner, Miss Morris. So it's yours sincerely, a registered nurse, emergency department. The hospital name is not given. So we have completed this thing.